The themes that I feel that resonate with Tyler's experience, written by McLeod 2011, is one, dyadic relationship life patterns influence caregivers' roles and responsibilities. And this is specifically when he says that he takes his vows seriously, and that he loves Lacey. He just never considered this being a worst that could happen for him. In a sense, Tyler has to remove himself out of the equal partnership that was established between him and his wife when they got married. He now has to look at things in a new perspective. So instead of seeing his dynamic with Lacey as an equal partnership, he now needs to view himself in a caring partnership. A second theme was that life patterns of caring for self and others were altered. And this is when Tyler states that he just feels like he doesn't know how to be her husband now that this has happened. And this is because McLeod 2011 states that spousal caregivers don't know what's the best way to respond in their new situation. And that's because they have to do things differently. They can't go about doing things the way that they used to before. So there's this notion that spousal caregivers, that there's a loss of personal time, meaning that they just don't have time to do things for themselves like they used to before. And they have a hard time adjusting as a caregiver instead of only just being a spouse. So this new role as a caregiver comes with new responsibilities that may seem daunting to them, because there's a lot of unknown. The third theme that I feel like resonates with Tyler's experience is that life patterns of certainty and knowing were limiting. And this is when he says that he can't imagine how their sex life might change. So basically, Tyler's sharing that he doesn't know how Lacey's recovery process will affect their sex life. So there's this fear of unknown. The theme that I feel like doesn't resonate with Tyler's experience is awareness of life pattern gave meaning and new perception on life left to live. And I just feel like he just hasn't reached that yet. It's too soon in their story to tell. He hasn't made any epiphanies about what his life means to him just yet. He hasn't had enough time to reflect. So the phenomenon of a young male caregiver differs from the old caregiver dyad in two ways. And the first one is that young men tend to be a little bit more healthy. So for this instance, I'm assuming that Tyler doesn't have any health conditions of his own that he needs to put his attention to. And then second is that young male caregivers may not have had the experience of being a caregiver before. So there's a chance that Tyler has never taken care of someone before in a way that is in a healing environment or helping another person grow and develop. And this is specifically because he hasn't had any kids yet. Number two, the ultimate goal of the nurse's work with Tyler in the Health Expanding Consciousness is that the nurse must assist people to recognize the power that is within them to move to higher levels of consciousness. And this is a quote by Ferris 2020. In other words, nurses need to keep talking to Tyler and help him reflect in what all of this means to him. And so that Tyler can identify that the old or the current way of doing things are no longer going to serve him or Lacey. So he needs to find a new way to approach their situation so that he doesn't experience burnout or stress and that he feels confident asking for help. This is because Newman believes that each person and each event are unique, and we need to honor them by using different approaches that will best serve their situation. So overall, nurses need to empower Tyler to take on his new role by helping him find ways to approach it and by helping him find what life means to him. So in the case of 2 weeks afterwards, the interventions that I feel like a nurse could use to help Tyler recognize adaptive and maladaptive patterns are, I feel like there are four. So the first one is that the nurses need to ask who in their support system can look after Lacey on the days that he needs to run his own errands. So for example, if he needs to go exercise or go to his own medical dental appointments. Second, asking Tyler how he copes with stressful events in the past, and then ask him if these coping strategies will be helpful in their current situation. Number three is to identify barriers in their environment so that Tyler can find new ways to overcome them. And then the fourth one I feel is that nurses need to give Tyler a safe space to freely discuss the meaningful events and relationships he's had in his life. And that will help him reflect on where he wants his life to be moving forward. And then the kinds of statements that might indicate that Tyler or him and Lacey will require more extensive support after discharge are saying things like, I don't feel ready to do this, I don't know what I'm doing, or that this is too much for me to handle. The kinds of behaviors or statements that might indicate that they have progressed enough towards expanded consciousness is saying things like, well, what matters to us is that we are together. I value the time spent together because I'm honored to take care of Lacey. Or saying things like, I need to take time for myself too. Behaviors or could be accepting help from an informal support system, such as Lacey's friends who she used to travel with, or her family members. And then also, Tyler could attend support groups made up of spousal caregivers where they can share and exchange ideas and their experiences. And then lastly, my conclusion about this case study, considering health expanded consciousness theories, is that it is very abstract. For one thing, it views patients as still healthy, regardless of their disease or disability, and that traumatic situations affect the patient's support system. So nurses need to help patients and their loved ones find what life means to them and keep them connected to their environment. Using this in my emerging nursing practice will help me assess patients and their support systems, how they view their lives. So also providing them with resources that are available to them in their community so that they don't always feel so burdened, feel the burden of their new circumstances, like using Meals on Wheels, connecting them to church volunteers to help them out with managing their home, or talking to their, or helping, or having their neighbors help out. And then just help them acknowledge that in these times, there's a lot of uncertainty and they can feel lost, and acknowledge those feelings. And then also view it as a changing time that is unique to them, because they do have support, as long as they are conscious about what truly gives them meaning in life, and asking them, what is it that really matters to you? What is important to you? So overall, when patients are facing changes in their lives, I feel that nurses need to sense that patients need help, and that nurses need to help patients understand what a caring partnership is. Thank you.